budget context.
So what is the government's preventative health strategy now? I mean, it seems to me that it's taken this money out of the National Partnership Agreement. It says that the money wasn't spent as efficiently as it should have been. How is it now going to be spent? What is your strategy for prevention? You're obviously abolishing ANPHA.
Well,
what else? Abolishing ANPHA, which we'll get to, I'm sure. The National Partnership Agreement, we're abolishing an agency specifically tasked with the prevention function. We're taking money away from the states to deliver prevention activities focused on tobacco, alcohol, physical activity. What is your strategy for dealing with prevention?
Well, firstly, Senator, it is efficient use of taxpayers' money to determine the best outcomes that we can in terms of preventative health. Now, we are looking at evidence-based information to direct the government in best way forward. Now, we've only, in terms of tobacco, we are, and I do, across the years, there's been a number of initiatives, most of which were instigated by the current Prime Minister as then Health Minister, taking very big steps forward in terms of tobacco prevention. Indeed, only in just the last few days, we've announced $4.6 million for a tobacco campaign to be run again to support those initiatives. I'm sorry, Sorry, Chair. Yes.
We were rewriting history at the time when you were still taking donations.
I'm sorry. I thought it was.
Please continue, Minister.
There's a range of initiatives. Obviously, we're targeting obesity, particularly through things like the Sporting Schools initiatives. There's a range of things. If you want to come to ANPHA, Senator, I'm very happy. I'm sure
to
discuss that. Or do you want to do that separately?
Well, you've had more than 5 minutes over the time that you were allocated, Senator Di Natale. What is it you wanted to further?
I'm just interested in hearing this about the strategy. And so far, I think I've heard there's going to be $4 million, which was money that was already spent on tobacco, and some money given to schools. That's the prevention strategy, as I understand it.
Senator, I was giving you a couple of vignettes, conscious of time.
But I'm giving you the opportunity to outline the government's prevention strategy, and it seems you haven't got one.
Senator, I'm quite happy to keep talking.
Please.
If you'd like me to.
Please.
Excellent. In terms of alcohol, the government's currently considering a range of measures in how we address that particular area.
Such as?
Just hang on a second, Senator.
Please allow the Minister to answer.
A range of measures is not an answer.
Senator Di Natale.
Thank you very much, Senator. In terms of alcohol labelling, as you may well know, there is a review being undertaken at the moment in terms of labelling on alcohol. We have now a meeting, as I've indicated to the Senator, of the Food Forum at the end of June, which will discuss front of pack labelling and related issues. So, Senator, I will take that on notice to provide you a fulsome answer, but I can indicate to you that the government is very serious about determining best ways forward to deliver the best outcomes we can in terms of preventative health.
So the strategy is a review and a meeting. A review and a meeting is not a strategy.
Senator, that is putting words in my mouth, Senator.